Hey everyone, welcome to the Nursing Insights podcast. My name is Stephanie and I'm a registered nurse practicing in the state of New Jersey. Getting right to it, the state of healthcare right now is tough, to say the least. Let's just say that the nursing shortage does not spark joy. We can sit in that and stew in it for a while, but we can't live in it forever. Things are changing. So join me as your host as I partner with the New Jersey Collaborating Center for Nursing to hear from nurses across the state about their experiences, trials, and triumphs in the nursing profession. In today's episode, we'll be talking with Carly Skibinsky, a medical surgical nurse at Hunterdon Health. Let's get started. So today we have Carly with us. Carly is a nurse at Hunterdon Medical Center. Carly, welcome to the podcast. Can you tell us a little bit about yourself?
Thank you for welcoming me on this podcast. My name is Carly. I am a registered nurse at Hunterdon Medical Center on 5 North, which is our surgical unit with med-surg overflow. So we have, I believe right now, don't quote me on this, about 26 beds. And so half of the unit, we have surgical patients, and the other half we have medical surgical overflow.
That's wonderful. So, just for the context for people who have never heard the term before, what do you mean by medical surgical overflow?
So we have another unit that basically takes all of the medical surgical patients, and then say that unit gets a little filled up or they don't have the appropriate staffing ratios and we're a little bit low on surgery patients, like for example, the weekends where we don't have scheduled surgeries or we don't have any, knock on wood, emergency surgeries. We will take patients that are considered medical patients that need to stay overnight or for a couple of days. So they will stay on our unit for a little bit instead of staying on the other unit for staff ratio purposes.
I see. Yes. So when you say mixed bag, you can really get anything and everybody.
Yes. And it's pretty cool because sometimes we'll get patients where they're like, I don't think they need surgery, but there is a possibility. So sometimes a lot of times GI bleeds will need to go to endoscopy. So we'll get them prepped with the bowel prep if needed, or endoscopy or colonoscopy. So we really specialize with that. So we're able to help those patients out. And we also have sometimes diverticulitis. So sometimes they will, hopefully not, but unfortunately they do perforate sometimes. So they will come to our floor, and we'll get our NG tubes all set up and we'll get them all prepped for surgery because our surgeons have a particular way of how they want things to be done. So we fortunately know how they want things to be done. So we'll get things all prepped for them. We'll call the OR, we'll get everything all set up and we'll send them down to the OR to get them ready for surgery. So they're all good to go.
That's great. And it also sounds like that means you have a lot of communication with other parts of the hospital, with a lot of different teams on staff. Do you feel like coming into practice, because I think we're going to talk about this, you're starting
Absolutely.
Your new nurse, you're a newer nurse.
Yes.
How was it like coming into this kind of, all-encompassing space where there's so many different groups to communicate with, so many different patients to come into, caring for? How was that transition for you as a new nurse?
I will say I was kind of one of the lucky ones. So I fortunately became a secretary on my unit 3 years prior to becoming an RN. So while I was in nursing school, I was a secretary, and then I became a nurse's aide / nurse intern is what we call it, where anybody that's going to nursing school, they start out as an aide. But with that terminology of nurse intern, the doctors will notice it on our name badges or the other nurses and stuff. And they're like, hey, you're going to nursing school. Come on in. I want you to check this out. So they kind of give you like a little insight, kind of like clinicals in a way of, hey, this is what I'm going to be doing. Come check it out. And you're kind of like a fly on the wall during time. So I was fortunate where the transition wasn't too difficult because I already knew who the surgeons were. They already knew my face. I already knew who to go to. I knew where the bathroom was, which is a huge plus. So it's funny now as a nurse, being a nurse for about 1.5 years now, it's interesting seeing the transition between new nurses that had some experience prior to being on the floor versus those who went to nursing school, focused on nursing school, which is not a problem, but they do have a little bit of a longer transition in understanding what to think of. Their critical thinking cap just takes maybe just a little bit longer, which is fine. So I was fortunate with that. And because I knew each of the surgeons separately, and they knew me especially too, which was kind of nice. So being about 6 feet tall, you kind of can't hide in the corner. So they're like, oh, can you come over here? Can you you reach this or whatever? And I'm like, yeah, I got you. So I really had a fortunate transition from being a nurse's aide / secretary to being a resident nurse to being a registered nurse, on the floor. So.
And what made you even decide to pick that, even decide to start off as a nurse's intern?
So, that's a great question. At the time when I was chit-chatting with them, I wasn't even really like talking to them about it. They were, I don't even know. I was like in pre-med. I was in health sciences at a university. I think I was my second or third year in university, and I was really enjoying it. And I remember talking to Dr. Jones, and I was asking him all these questions like, okay, what should I do in this regards? All this different stuff. And he was like asking me a couple of questions, and I was telling him, what I thought. Now, here's a big thing. I was obsessed with Grey's Anatomy at the time. And, when you watch the show, you're like, yeah, I want to do that. And it's so funny looking back on it. I'm like, all those shows, like, do not show you how the hierarchy of the hospital works. What all those nurses were doing when you didn't see them, the background work and everything. And also the doctors in the show were doing the nurses' jobs too. A lot of them were picking the patients up and going for walks with them and giving their medications and talking to their families and educating their families. And I remember talking to Mr. and Mrs. Dr. Jones, how I want to be with the patient. I want to help the patient. I want to do all of this. And, I really enjoy working, and I don't want to be stuck behind the computer. That was like my biggest thing, was I did not want to be sitting around. I wanted to be moving around. I wanted to be doing things. And I remember Mr. Dr. Jones was like, Carly, you don't want to go this route. You're going to want to be a nurse. And I was like, I kind of like paused, and I remember looking at my mom, and I was like, what are you talking about? Like, I just switched from pharmacy and now I switched to pre-med. Like, what are you saying? Like, you were saying that I should switch again? Like, I get this is the moment to really find yourself, but I was like, what the heck? And he's like, you're going to want to become a nurse. And I remember he said, and even his wife interrupted him, and she was like, yeah, no, you're going to want to join the nursing field. And she explained everything and how she was writing a book, and she was talking about her story and everything. And I was like, wow, that's so fascinating, and I was just like, that is so cool. Okay, maybe this is the route. And I'm like, that's great and all now that we figured it out, but like, where do I go next? I already had so much schooling background. I'm like, do I transfer out? Because the school I was at didn't have a nursing program. So I was like, do I transfer out? Like, what do I do? I was graduating early. Do I continue to go this route and get my bachelor's in health science, or do I switch out and get my bachelor's in nursing? And I will never forget, Mrs. Dr. Jones worked with Raritan Valley Community College nursing program. You're going to want to try and go that route. You're going to want to get exposure in the hospital, figure out what works best for you, and see where it takes you. So after talking with my mom and everything, because I also played collegiate volleyball, I was a resident advisor for 150 freshmen, and I really enjoyed my major as a health science major. And so I sat down and I thought to myself, and I prayed a lot too, and I was just like, okay, what should I do? So what ended up happening is I graduated early with my bachelor's in health science, and I graduated in December of 2017. January of 2018, I got a job at Hunterdon. At the time, it was Hunterdon Healthcare, but we switched to Hunterdon Health, and I was a secretary for outpatient, and I was a float PSR, patient service representative. So I was a float. So if somebody called out, I went to one of their 40 something locations. And so I got to see the different offices that they had outpatient, where I got to see primary, I got to see GI, their specialty, I got to see pulmonary, I got to see so many different types of practices, which was really awesome. And then I remember I would constantly go back and talk to Dr. and Mrs. Jones, and I'd be like, hey, this is what I'm doing. Like, what do you think? Do you think this is working? And she's like, Carly, you got to get into the hospital. You got to get in. And I'm like, okay, I get it. Like, let me see what I can do. And so at that time, that's when I was also applying to RVCC, Raritan Valley Community College in Branchburg, that she asked me to apply. So I got in, and I remember sitting in orientation, and they actually recommended that you do not work when you're in nursing school. And I remember having this like epiphany moment, like, but that's not what I've been told that I'm supposed to have exposure and try different things and try a lot of stuff. And I remember going up to the professor who explained, like, we really don't recommend you working during the time. And I remember asking her, I was like, can I speak with you on the side about this? And I said, I'm at this point where, I have my bachelor's degree in health science, going to get my associates in nursing. Why are you saying that I shouldn't do it? I just need an answer. And I'll never forget, she said, when you go into the hospital, it conflicts with what you learn in nursing school. It's how I took our conversation. So I said, okay, thank you so much for your feedback. And I remember going back home and I was thinking, I'm like, okay, should I just met this person, I really want to succeed in nursing school. They talk about how nursing school is so hard. And looking back on it, my associate's degree was so much harder than my pre-med bachelor's degree, which is insane to me because you don't really get that. You're like, oh, associates, it's not that hard. But nursing school really kicked my butt. But I learned so much from it. I would not change a thing. And what I ended up doing was I transferred from being a PSR to being a nurse's aide on 5 North in the acute. And what's cool is at Hunterdon Health was they had the nurse interns, where if you were in nursing school, you got the nurse intern ability, everyone knowing you were a nurse intern, and you worked as per diem. So you got to work as many or as little hours as you wanted. So I knew when you get your itinerary for the whole semester, I'm like, okay, this is when midterms are, this is when my clinicals are, this is when finals are. Obviously, I'm going to do less work during those times. And then during the other times, I would work a certain amount of hours. And I tried it out. And I remember when I first started, I started with 3 shifts a week. That changed pretty quickly. I changed to, 8 hours to 12 hours, just depending. And that was what was really cool, is being able to communicate with my director and saying, hey, I'm really struggling with this. I need more time to study. And it was really nice because there were other nurse interns that were at other schools from the University of Delaware, from Muhlenberg, from Rutgers, from everywhere. And it was just so awesome to be able to collaborate with other nurse interns. And we're all struggling with nursing school. Okay, it's really hard. But what was awesome about being a nurse's aide or nurse intern was when I would have these certain questions on the test, it's kind of hard to put it into context sometimes. Like, you're reading your textbook, you're trying to develop that critical thinking, clinicals helps, but you're not like fully immersed into it like you are like a nurse intern. And I'll never forget having one test where it was hard. And I remember getting to one question and I'm reading it and I'm like, I just took care of a patient in 513 that had this. What did we do? And I'm like remembering, I'm like, what did we do for that patient? And I thought about it and I'm like, that's exactly what we did. And I'm reading, it's all multiple choice. I'm like, okay, what's the best answer? And honestly, like, all of them could be the correct answer. It's just which one's the most correct. And I remember I was like, you know what? It's C. And I was like, wow, okay. It made me realize, like, okay, yeah, I'm struggling and I'm having a hard time mixing everything all together. But being a nurse intern helped me so much because I got to put real life experiences to my test. And it really helped out because I was able to not only help myself, but I was able to help some of my peers as well, and being like, hey, well, I had a patient just like this, and bringing it to class and everything. And it's really cool. And it's funny because we have one of the professors at the school is now a coworker of mine. And I remember when I first started working there, I was like, hi, professor. And she's like, we are not professor student anymore. You're a nurse. I'm a nurse. You call me by my first name. And I was like, okay. Like, it was just like funny, when you get older, you're like, hi, Mrs. Smith. And they're like, I'm not Mrs. Smith anymore to you, like, I'm Jen or whatever. And it was just like this whole switch of like, all right, I'm a nurse now, and it was just like a really cool experience of trial and error of figuring out, okay, what works best for me, and just putting yourself out there, just trying it.
To be able to wrap up the story and bring it back,
sure.
Did you ever get a chance to go back to the doctor and Dr. Joneses and tell them about your experience becoming a nurse?
Sometimes, yeah. We don't really get to talk as much. They actually moved to the other side of the country, so I don't get to see them as much, but they do come back every once in a while. So they came back this recently and I was able to see them. It's just really awesome being able to talk to them now and talk to Dr. and Mrs. Jones and know all the terminology nowadays.
Oh, it's amazing. And your perspective, I am 1,000% certain that your perspective of being willing to ask the questions and being willing to show up and say, hey, you can't know everything. I am certain that also helped your transition.
Absolutely.
Because there's no way that anybody can come and knowing anything. And you had mentioned the residency in there and having mentorship in there. Do you mind sharing a little bit more about those things?
So Marianne Sweeney right now is the head of the nurse residency at Hunterdon Health. And she has been there as a clinical nurse leader for years prior. And she was actually the clinical nurse leader on 5 North. So I felt like I had a little bit of a closer relationship with her than some of my other nurse resident classmates, I guess you want to call it. And she's just a wealth of knowledge. So it was awesome being able to meet with her once a month. We would meet on a Thursday. We met for about 4 hours, I believe, 8 a.m. to 12 p.m. And what would happen was it's evolving. That was the kind of the cool thing is with Marianne was she was always asking questions like, hey, what do you guys need from me? She would always incorporate different things. She's like, okay, thank you so much for the feedback. And she would get different people on board. They would give us lectures from different people. So like, for example, we had one person that was part of our holistics committee, and she came in and she explained what aromatherapy was. And she explained how you can get your certification and be able to incorporate it into your practice. So that was really cool. And then we also had different people from staff development. For example, like Sue Daneka, she would bring us to a patient's room without a patient, obviously, and go over different scenarios during a code or like different terminology that if, say, we called a rapid response and say that patient needed to be intubated or anything, she would go over the different terminology that the APN or advanced practice nurse would say. So we were like, okay, that's good to know. She went over the code card, like what drawer everything is in, because it's just, when you first look at it, it just looks like a big blue box. And you're like, okay, everything's not really labeled. But then once you get to learn what everything is in the code box, you're like, okay, that's exactly where it is. And that makes sense why it's right there kind of thing. So it was a learning experience, and it's an overwhelming experience too, because I know we were talking before this podcast and you were exactly right about this, where if you, any other profession, but especially this profession, you are being taught by everybody, and that transition, you start from day one of taking care of patients. And that really resonated with me. And I'm like, yes, you're absolutely right with that. And having this nurse residency and having a mentor, you got to choose your mentor. So my mentor, I actually chose my preceptor, actually, because I really enjoyed my experience with her. And it was funny because she worked days and I worked nights at the time. But she had a baby. So she was funny because she's like, Carly, I honestly will probably be up feeding the baby. So you are more than welcome to text or call me. And it was funny because it was before we had the resource nurse that we have on at nights, which is someone that is not designated to any patients and just floats around the entire hospital to our different units and is like, hey, is everything okay? Is there anything you need to go over with me? Or is there just a patient that seems a little off? That's not like, we're not there yet for a rapid response, but like you just have a gut feeling that something's off. So before that, I would text or call Lisa Penyak and she would crack me up. She's like, Carly, what do you think? Like before she would even tell me the answer, she was like, what do you think? And it made me really think, okay, like based on my knowledge and based on what I'm feeling with my gut feeling, this is what I think. And I would tell her and she would tell me yes or no, or like, you're half right. And it just made me feel good. And she is a great mentor to me to this day. And it's really nice to work with her now. And it's just kind of cool seeing how she's been a nurse at Hunterdon, I think for 15 years, and just seeing how she has so much more knowledge than me, but she's not perfect either. And it's kind of cool seeing these different nurses, because I don't know if everyone knows, but the healthcare field is continuously evolving.
Absolutely.
The big thing is different procedures, different policies change. And, sometimes you get stuck in the old ways. And sometimes that new nurse is like, that's not how we're supposed to do it anymore. Like they go over policies in nurse residency once a month with us. And I was like, oh, I thought we're supposed to do it this way. And they're like, not anymore, and make sure you bring it back to your unit, and spreading the word is how things are done. So just word of mouth is what helps. So it was kind of cool, being able to go back to my unit and be like, hey, you know how we've been doing it this way? Like, it's not supposed to be done that way. And they're like, what are you talking about? And don't get me wrong, there's some people that will push back, but I think with having the confidence to be like, no, I learned this in nurse residency. If you don't believe me, I'm more than happy to direct you to someone else. But this is what I heard. And I just want to clarify it with you. I'm not saying you're wrong. wrong. I'm not saying I'm right. I'm not saying I'm wrong. And I'm not saying you're right. I just want to make sure we have a common understanding of what is supposed to be done for our patient. So it's pretty cool to go over, the policies and procedures online and through the intranet. It's not internet, it's intranet. So it cracks me up because everyone like slows down when they say it. It's pretty cool stuff. It's just like continuously evolving. So it's a lot of fun.
And I mean, I feel like that's just such a hallmark of the profession in general, is to be able to think on your feet, have the humility to say, I need to keep learning, have the humility to say, I want to do this for our patients. I mean, to be able to do that and to encompass that means to be able to build this culture that nursing is about, like patient-centric, also recognizing that we ourselves are human and that, the conversations about burnout, about resilience, especially framed by the pandemic, have been such a, salient kind of conversation topic. Absolutely. So to be able to take that and bring it into your unit and to share that as a culture in your unit is absolutely amazing. I was curious if you don't mind actually sharing a little bit about the transition through the pandemic and how that was for you as a new nurse.
It was really difficult. It was just weird because it just came one day and everything changed. Like we were just chit-chatting, we were able to talk and just be next to each other and have lunch together. And this was like when I was an aide. So then once March 2020 happened, I'll never forget, I was at clinicals on a Saturday at a different hospital and just something was off like on the unit. And it was funny because my classmates at the time, I don't think realized what was happening. And I was like, there is something different going on. And I brought it up to my professor who was a NP on that unit. And she's like, yeah, there's something off, but I'm trying, like, don't say anything. I don't want to scare anybody. I was like, okay, sounds good. And I'll never forget, we left early that day. And then we got an email that Monday, everything was called off. Like everything was put online. And I remember I was like, okay, well, just because everything's online at school doesn't mean my work is online. And I remember walking into the hospital and the front desk people were handing out masks. So I put a mask on and I remember walking up to the elevator and they're like only 3 people at a time. We used to just crowd all into the elevator and I'm like, okay, sounds good. Like we're all isolated. Like, okay. We got up to the floor and I just remember the doors being closed, like we used to have the doors open. We used to have everybody all close together. And I just remember having all the doors closed. And I remember the patients were so confused. They're like, what's happening? And unfortunately, we didn't understand what was happening either. Like we were continuously getting emails. We were continuously being notified by our directors and stuff like, hey, this is what the state or this is what they're recommending that we do next kind of thing. And I remember there were some days where we just wore a mask and then other days we would wear a gown and then we had to walk around with a gown, but then put a second gown on top of it. And then we switched to the N95s with the shield. And I remember some people would just put like a little tape of their name because everyone like didn't know who was who. And the poor patients, I think that was probably the hardest for me was they didn't have families coming to visit them. A lot of times we had patients who were getting surgeries that had to be rescheduled or canceled. So our unit became the COVID unit, but we were like considered the stable COVID patients because we were a med surg unit. Like we weren't trained to take care of vented patients or any of that stuff. So we took care of the stable COVID patients. But as we knew at the time, we didn't know anything. So sometimes our patient would be fine, healthy, no comorbidities and no past medical history. And then boom, like just everything just crashed, and you're just like, what are you supposed to do? So that was really hard for me because I was like, this is not what I want to get into. But at the same time, though, is I didn't want to leave either because I would be leaving my team down. Like I would be letting my team down. So it was a learning experience because we would call rapid responses out of nowhere and we just had the team and we had the people there and everyone just rallied together and it was just a beautiful thing. And then unfortunately, a lot of people got burned out. A lot of people were like, okay, this is my time to leave. I need to retire. We had some people retire. We had a lot of people go to travel nursing, which kudos to them. I don't blame them. The money is very enticing and they had the experience to do it. So it's a perfect time to try and travel. It left us a little dry. We lost a lot of our staff, but it made us stronger and it made us tighter. And it's funny because now looking back on it now, like even just this past weekend working, like I'm definitely obviously closer to my fellow coworkers that we worked with together during COVID. And you just like have this like telepathic connection where you're just like, okay, like you give them like a little look and then they just know exactly what you need. Whereas like, you know, people that came in after COVID, like they're still developing those skills or they're still developing that like connection with their coworkers / teammates. Because when I officially graduated in 2021, the second wave hit and I had to start out right away. And I'll never forget, some of these patients were not just physically sick, they were psychologically sick because they were so isolated that they were just literally losing their minds. And I would be the only person they would see that entire 12 hours because we were drawing their blood at night. Families couldn't see them. A lot of times doctors, because they have so many patients they have to see, sometimes they would just ask us like, hey, how's the patient doing? Can you go in there and give them the phone so I can talk to them? So I would, you know, gown up again and I would go in and I'm like, hey, the doctor wants to speak with you on the phone and everything. And it was just a whirlwind. And unfortunately, we lost a lot of patients. Either they passed away on the floor or, you know, they got advanced to a more critical unit so that they could get better care with smaller ratios. Honestly, it was just not a fun time. And the one thing that was nice though, is we had a couple of people on our unit that would try and develop different events for us to do outside of the hospital to get to know each other. So we had one nurse on our unit. She loved doing little things with us. So we would go to her house and we would do little parties, like birthday parties and stuff like that, just to try and bring some sense of like, everything's going to be okay. Like, we're going to make it through. We got this. And also at that time, I don't believe we had a director at the time either. So we were like in the transition of like a new director as well, because I believe our director at the time, she medically couldn't be on the unit. So she couldn't be there. Marianne Sweeney kind of really stepped up to the role of being director temporarily until we got a director. I guess that's why I kind of have like a soft spot for her, is because she's really helped me through the transition of being an aide to a nurse and everything. So it's been something. It's funny. I don't really like to go back to it, which is probably not healthy, but it's definitely something that I wouldn't regret going through again if I had to go through it again, because I learned so much during that time, if that makes sense.
I mean, you sound like you've been the definition of resilient, because both having to graduate, having to adjust to your new practice, having to adjust to leadership and, you know, changes, and then also having to just adjust to a new workload, because coming from a nurse intern to being full registered nurse, how did you take care of yourself in that transition with this new wave of responsibility?
Absolutely. I'll be honest, I did not take care of myself during that time. I ate a lot of garbage food, candies. I actually stopped working out during that time, which made sense because the gyms closed and I was just physically and mentally and emotionally exhausted. So I'm not kidding. I think I would sleep 12 to 15 hours before work. I was always so nauseous because I think of the anxiety of like, okay, what's going to happen during my 12, 13-hour shift, that I wouldn't eat before I would go to work. Like, I would bring food with me, but I wouldn't eat until maybe halfway through my shift because of my anxiety, and my nerves at the time were just through the roof. So I'm not going to lie, I did not take care of myself whatsoever during that time. And now looking back on it, I probably could have been a lot better of a nurse for my patients if I took care of myself first, because I always put my patients first, even before my family, before myself. And it really made me hit rock bottom for a little bit. And then that's when everything clicked a couple of months ago. Actually, once I was like, okay, I graduated nurse residency, I'm starting to feel a little better. I can eat now before my shift. So I started going back to the gym and I've lost a lot of weight and I started eating healthier. Don't get me wrong, I miss my Starbucks, I miss my, candy bags and everything, but just realizing the nutrition that I put in my body and making sure I work out. Like, I always work out right before my shift. I know a lot of people think I'm crazy, but I truly believe that by giving myself that hour or hour and a half to myself and really feeling how I'm feeling from head to toe makes me feel good about myself. And I'm like, okay, I'm good to go. I feel great. Now I can go take care of my patients. And I just feel more awake. My coworkers could tell you the amount of coffee and Starbucks that I drank and ate feet was astronomical. I lost so much money. I should have been an investor of Starbucks because I spent a lot of money. But anyway, so because I've transitioned from that, I definitely recommend working out. It's funny when I talk to people that don't work in the healthcare field and they're like, you only work 3 days a week. And I'm like, yeah, I work 3 days a week, but it's not just like a 9-to-5 job. Like it's a 12, 13, 14-hour shift sometimes, depending on what's happening. And you're constantly going. It's not like you're just sitting there, you're thinking, you're trying to multitask. You're trying to figure out like, okay, I have 5 patients. Which one do I need to see first out of my 5 or 6 or 7 patients? The unit that I'm on, because we have surgeries, sometimes a lot of those surgeries will come in the afternoon. So we have a lot of influx. So since I've switched to day shift, I'll have up to 9 patients in total at the end of my shift, not all at once. Like I'll have my set of patients and then they get discharged. Now, all that education that I got to teach them of like, okay, you have JP drains. This is how you empty it. This is how you make sure if you feel this way, you need to call your surgeon. If you feel this way, you need to call the pharmacy, or if there's something wrong with your medications, just making sure everything's all set up at the pharmacy, making sure if they have a walker, if they need a walker, there's just like you're literally in charge of everything. And then once those patients leave, you're not sitting down like, oh, I got an hour to chill. Like that's not the case. You have PACU, which is the post-anesthesia care unit, is calling you, giving you your next patient, and you have your charge nurse that will help you out, but like they are in charge of the whole floor. So, you got to really multitask. You got to make sure you're on top of your charting. I cannot stress that enough. You got to stay on top of your charting, because once you're behind, you're going to be behind for the rest of your shift, and you'll be there 2-3 hours after your shift trying to get going on your charting. That's another thing I think that was a huge transition for me as a nurse resident, was the charting, because I knew where the bathroom was, I knew where the supplies was for my patients, but the charting was really what kicked me in the butt, was being, okay, I gotta make sure I'm on top of it. The doctor came, and I remember I would be like, which doctor is this again? Because I remember I had all the masks on. I'm like, okay, who was that? And then you go in after the doctor leaves because they're already on to see their next patient. You go in to see the patient and you're like, okay, what did the doctor say? And they're like, I don't know. So then you got to quickly track down that doctor and be like, hey, what's the plan here? And you can't be afraid to say, what is the plan? Because sometimes some doctors or some professionals are just trying to get through the day. They don't just stop for 2 seconds to think, okay, what is this patient here for? Oh yeah, okay, like this is the plan. You're an advocate for your patients. Your patients don't want to be there. Unfortunately, like no matter how much you make their stay as enjoyable as possible, they do not want to be there. And just making sure they feel a sense of autonomy and feel a sense of safety goes a long way, because once they don't feel safe, you're their enemy, and you got to make sure they feel safe and they make sure they feel comfortable. I know it's funny, but just giving them that warm blanket really goes a mile. Even if they didn't ask for it, just bringing in, being like, oh, wow, my nurse thought of me. Like, it just makes them feel better. It's pretty cool stuff. I don't know. I enjoy it.
It sounds like you absolutely do. And I love the element of human connection that you're bringing in, because whether it's with your physician, with your patient, with your team members, your coworkers, there's this like inherent human connection that I think can sometimes be lost in any job, but especially in one such as as busy and as urgent as nursing, because we literally are taking care of humans with our hands and we want to do the best that we can.
Stay tuned for part 2 with Carly. Thanks for listening, everyone. We'll see you next time on the Nursing Insights podcast.
This podcast is brought to you by the New Jersey Collaborating Center for Nursing and the Rutgers School of Communication and Information.